can be serious.
90 to 95% of people cannot be allergic.
Right. Highly effective treatment options for countless types of infections. Hello, and welcome back to the Medicine Cabinet. We're your hosts. I'm Dr. Kia Mozani.
I'm Dr. David Stewart.
And we are practicing pharmacists. And today's topic is one that is not only super common in any healthcare setting,
Very common.
but can also have dramatic effects on the care that you receive.
Yeah, and we're talking about penicillin allergies. And this is something, and studies have shown that 10% of people report having an allergy to penicillin. It's quite common to hear. I'm sure you've had patients who mention that they think they're allergic to penicillin, or maybe their parents told them when they were very young that they had a rash when they took penicillin. So it's quite common. What we now know, though, is that up to 90 to 95% of people who report having an allergy to penicillin turn out, once they're tested, to not be allergic.
Right. So that means basically, let's say there's 10 patients who come into the pharmacy or come into the hospital, and either they say or their chart says that they have a penicillin allergy. Out of those 10 people, 9 of them truly do not have a true allergy.
That's right. And so there are a few different reasons for this. One common reason is the improper labeling of intolerances as allergies.
So now what does that mean? Well, say you take an antibiotic and you experience an upset stomach, vomiting, nausea, or just tastes bad. And that can be labeled as an allergy, when rather, in reality, it is more accurate to characterize that as an intolerance or as a side effect that is many times expected and can be managed through many different ways.
Yeah, that's right. And another reason would be there's a lot more evidence coming out in the field of allergies and immunology that shows that our immune response can reduce over time.
Exactly. So with penicillin allergy, let's put some numbers to it. It will be 50% of those people who had an allergy would no longer have an allergy to it after 5 years. And that number jumps up to 80% after 10 years. So you can see that allergy just continues to decline.
Exactly. And so there are certainly some interesting numbers, and you might be wondering, so what, right? What's the importance of this? Why do healthcare providers concern themselves with, penicillin allergy? We've got a lot of antibiotics on the shelf. And the reason that we ask about this is because in this context, improperly labeling someone as having a penicillin allergy can lead to worse health outcomes.
Right, exactly. And so why is that? Well, let's explain this really simply. Simply put, penicillin and other medications in the same class or in neighboring classes are highly effective treatment options for countless types of infections and are often the first line treatment for many of these infections with the most evidence. And so that means, let's say someone's file or their file at the pharmacy or their chart in the hospital says that they have a penicillin allergy and they were to get an infection. That means that they would receive a treatment that is either less effective or has more side effects and more drug interactions, or simply contributes to the growing antibiotic resistance, which is a problem that we're facing.
That's right. So what should you do, right? If you have had a previous reaction to a penicillin or you're not quite sure if you're allergic, what should you do?
Yes, so penicillin allergies, although as we've established are uncommon, can be serious though if you do have a true allergy. And so it is important to always check with your healthcare team. They can gather a complete history, do a full exam, and try to understand, the type of reaction that you had, when it occurred, what symptoms you had, all those kinds of things. Full history to determine what is best for you and kind of work with you to come up with that approach.
That's right. And in some cases, if it's appropriate, your healthcare team can refer you for allergy testing just to find out for sure.
Yeah, and if you're curious about what that entails, drop a comment down below and we'll make sure to make a separate video on exactly just that. But for now, that brings us to the end of this video.
So thank you guys for watching. Make sure you guys hit the like button, smash the subscribe button,
comment,
post notifications. You know what you got to do. We'll see you guys in the next video.
Peace.